As the FDA gives a big green light to 2 new COVID boosters, health officials here in Utah say it couldn't have come at a better time as they're seeing a rise in cases. News specialist Lauren Steinbrecher has our story.
The Salt Lake County Health Department says as people start coming down with those fall illnesses, aside from getting the COVID booster, there's another huge step they need to take when it comes to testing for COVID at home.
Our epidemiologists check the data every day.
The Salt Lake County Health Department is paying close attention to rising COVID cases.
You can see that we have had a considerable increase.
Nicholas Rupp sees the spike in numbers on the graphs with the hope of prevention.
So we want to avoid any of the major respiratory illnesses, right? We don't want to have influenza or COVID or RSV.
University of Utah Health sees the patients coming through the door in hopes of treatment.
Some of them is relatively mild, just sniffles and sneezes. And some of them have bad pneumonias.
As they take in more COVID-19 cases, ranging in the hundreds instead of the usual dozens, U of U Health is waiting to give out the new vaccine booster, which Dr. Russell Vinnick says will be effective against the most recent COVID variants.
You know, it's kind of like wearing a seatbelt in your car. They're not going to prevent you necessarily from getting in an accident, but when something bad happens, they prevent the worst of consequences.
The Salt Lake County Health Department is also waiting for the CDC approval expected Tuesday.
We should have it in stock, assuming that approval occurs, in the last week of September.
For anyone getting sick now, Rupp says check the date on your at-home COVID test, because even if the expiration has long passed, like the one he's holding that says last January,
many of the tests do have the expiration date extended by the government.
It could still be fine to crack open.
Check on the FDA website. But that's been extended to January 2024.
Some helpful tips as fall sicknesses sneak back into the Beehive state. The Utah Department of Health says that while wearing a mask is an individual choice, not a bad idea for anyone who is immunocompromised or elderly or anyone who is around them. Anyone who is sick should just stay home. And if you do have one of those at-home tests, make sure you check to see that it's good to go. Lauren Steinbrecher, KSL 5 News.